This is our 12th time. You know, when we first started doing this, I had a daughter who was, at the time, 2 years old. She's now 13. She's starting to tell me what to do. I try to listen very carefully. I think as we move to this 12th time, we want to try to do something a little bit different. First, I should introduce myself. For those who don't know me, I'm Gary Puckrein. I'm president of the National Minority Quality Forum. And for the last 11 times that we've done this, we've paid a lot of attention to listing problems, enumerating the challenges. This year, as you look at the agenda, we are trying to solve two big problems and beginning to lay the groundwork for a future. The big problem is that we do not have a lot of minority-centered patient advocacy organizations. When you look at the landscape, I'm privileged to be in Washington, so I attend a lot of health policy meetings. And I'm absolutely stunned at the incredible lack of diversity, just stunning lack of diversity. It's compounded by the fact that it is so backward looking. It looks at healthcare from the lens of the 20th century, where we could speak credibly about a majority population and then minority populations. The reality now is that we are a biodiverse America, that the majority of Americans under the age of 18 are what we used to call minorities. And it is not just the importance of that demographic shift. It has profound implications for healthcare because the marketplace has changed, the consumer has changed, the requirements of medicine have changed. And for those who do healthcare, you know that it takes years and years to translate policy to bedside, to something actionable. So by the time we get to 2030, there's no more majority. We're wrestling with the issue of diversity. And I sit in meetings all the time and I raise my hand and I say, well, how does that policy impact diverse populations as if I said a bad word? The silence is stunning. So one of the things that we're going to try to do here, and as you look at your addendum, we're starting to pull together in therapeutic areas patient advocate voices. And so we'll talk about it at this meeting today. And what we want to try to do after we leave the meeting is to reach out to you and ask you, will you be part of this alliance tackling a problem? And we think that the best way to tackle them, to bring alliances together, is to actually do something, not to talk about it, but to take very particular problems that we see in minority communities and deal with them. You know, the tendency these days, we talk about health disparities from the Hackett report in 1984. But if anyone read W.E. Du Bois's The Philadelphia Negro in 1898, you would have known there were disparities there. If anybody knew the history of Booker T. Washington in 1915, you know that he organized Negro Health Week in 1915 to deal with health disparities. The difference between those generations and this generation is we are part of the body politic. We have the right to vote. We have to use that vote. And part of patient advocacy is to use our voice, African Americans, Hispanic, Asians, Native Americans, to make sure that our communities survive, that we have the ability to provide quality lives. So that's our big agenda. That's what we want to try to start that conversation with you today. We don't want to walk out of here with another list of all the bad things that are happening to diverse populations out there. It doesn't do them any good, doesn't do you any good, doesn't do our future any good. And I'll stop here with this one final point to show you the urgency of the matter. Right now, today, 38% of everyone with diabetes in the United States is minority, right? By the time we get to 2030, 46% of everyone with diabetes will be African American, Hispanic, Asian, and Native American. Today, if you include hospital readmits, 60% of those minorities are going to the hospital for diabetes, it's an underlying condition, every year. If you throw in emergency room visits, it's 75%. So think of America and its workforce in 2030 with 75% of the near half of the population with diabetes. Well, you can't do that. I mean, you fundamentally can't have a society that looks that way. And so for all the conversations about Obamacare and this care and what care, the fact of the matter is that our future is in front of us. We have to articulate it. And, Eddie Williams, who was at the Joint Center, I was having dinner with him one night, and he said that folks would come to him and wanted to know why the old guard, this is the old civil rights establishment, why wouldn't they get off the stage? Because the young and energetic wanted to have room. And he said, well, they don't leave the stage. If you want the stage, you got to go get the stage. And that's what I'm telling you. Those folks ain't going to leave the stage. They're there. And so if we want to have quality health care for our community, we got to go get the stage. And so that's what this is about. That's what this meeting is about. So I want to thank you for being here. I think this will be an interesting meeting. I'd love to get your feedback, and we want to collaborate. Part of this, some of the change that's happening, Congresswoman Robin Kelly has picked up the mantle from Congresswoman Hutchinson, Congresswoman Stokes, in the Health Braintrust. And we've been excited to work with her staff. They're energetic and young, and our staff's a little old, and so we've been trying to keep up with them. They're moving like light speed, and we say, okay, we can run with the big dogs too. We'll try to keep up. And it's been a lot of fun working with them. And so it's really a great honor and a pleasure to introduce Congresswoman Robin Kelly.
Good morning and thank you. I'm happy to be here with Dr. Puckrein to welcome all of you. This is my first spring Braintrust as chairwoman of the Congressional Black Caucus Health Braintrust, so I'm very excited to be here with you. We have a wonderful program planned for you over the next 2 days. Thanks to both of our staff. They have been absolutely wonderful and so helpful in putting this together. We will have sessions with some of the best and the brightest minds in the healthcare space. I'm really looking forward to engaging with you in a robust dialogue on addressing minority health disparities in America. I'm also looking forward to meeting you and learning how we can work together to achieve health equity. We do take the Braintrust on the road. I was already in North Carolina. In May, we will be going to Los Angeles and Oakland to discuss AIDS. And then in, I believe, June, I will be going to Denver because it's Men's Health Month, and we'll be working with the mayor of Denver. So if you represent represent any of those places, please come out and join us. So please make sure you introduce yourself to me and my staff. If my staff could just wave and raise their hand. I see Brandon in the back, Casey, Audra, and I know BG is running around somewhere. But we really, really want to connect with you and collaborate with you and learn from you. So thank you for joining us today, and I look forward to the conversation. Thank you.
I'm going to ask Dr. Lawrence Saunders, the president of the National Medical Association, to come up and bring greetings.
Good morning, everybody. First, I want to thank Dr. Puckrein and Congressman Robin Kelly for inviting me. I am honored to stand before you as the 115th president of the National Medical Association. And I also want to recognize several of our members and past presidents and our president-elect who are here, Dr. Randall Morgan and Dr. Sandra Gaston, who are past presidents, and Dr. Edith Mitchell, who is the president-elect of the National Medical Association. Now, I hope I don't talk too long because I got a couple of things that I want to say. I want to really share a couple of things with you. I want to tell you a little bit about the National Medical Association and why I think it's important that we are here. I want to talk about the public policy priorities for the National Medical Association, and then I want to leave one thought with all of us about something that we can all do on this march to health equity. And I'll try to make this relatively short. The National Medical Association was founded in 1895. And for more than 115 years, it served to bring together men and women of African descent who were engaged in the practice of medicine. Initially, dentistry and pharmacy were part of our group. And today we build on that same tradition of bringing African American men and women engaged in medicine together for the purposes of support, renewal, education, and advocacy. We represent the interest of all African American physicians in this country and the patients that they serve. So we're committed to working with each of you on this journey to health equity. Now, I want to say thank you to Congressman Kelly and to the rest of Congress for really helping us together take the sustainable growth rate formula off the table. And also for extending the funding for the Children's Health Insurance Program. And I know how hard it is to, I believe I know, I'm not a congressman, I'm not there, but I get to see it on TV. I know how hard it is to do bipartisan things in this Congress, and so I have to take my hat off because I think this is a historic bipartisan effort. But more importantly, I think it sets the stage for a bipartisan commitment to achieving better health care at lower costs with better health outcomes for all Americans. And I believe we're well on that path. And with that, I think that it's very important that when we talk about better health care and better health outcomes, that we recognize that quality and outcomes are extremely important. Quality is defined as health care that's safe, timely, effective, efficient, patient-centered, and equitable. And when we talk about quality and outcomes, and as we make this move from volume to value, one of the tools that we are looking to use is the whole idea of more transparency around outcomes and more transparency around quality. Evidence-based guidelines and new payment policies are clearly ways that we want to accomplish that. Now, in talking about how we get things done and how we move forward, I think we need to look at the process of evidence-based guidelines and quality measures to make sure that the transparency is not misleading. Evidence-based guidelines and new payment models must take into account the complexity of caring for patients with disproportionate burdens of disease because of long-standing health disparities. Now, let me try to make that a little bit clearer, and I'll tell you a story. I'm going to compare two patients. Both live in my state of Georgia. Right? Let's just imagine this for a moment. One patient is a 60-year, and they both need knee replacements. All right? Can you follow the picture? One patient works as a machinist. He gets his insurance through his employer. He's got a strong family support. He lives in a community that has readily available rehab services and support services for physical therapy and has a nice recovery. Now let me take the other patient who lives in Georgia as well. He's a 60-year-old man who works as a mechanic in a neighborhood garage, which he's the co-owner. He's lived for many years without health insurance. As a result, he has hypertension, diabetes, which have been poorly controlled, hasn't been able to afford the medicines. And as a result of having poorly controlled hypertension and diabetes, he's got some kidney disease. His cholesterol is elevated. Both of them smoke. They both drink a little bit too much. Second patient, his oldest son is in jail. His daughter and her 2 boys had to move back in with he and his wife because she lost her job. And in order to get rehab and physical therapy, he has to travel at least 15 minutes every day. And so what I would like to share, if you could think about the resources required to achieve the same level of outcome for patient 1 versus patient 2. Patient 2 represents much more complex clinical care, but not only clinical care, has much more complex social issues that represent the consequences of long-standing inequities that exist in many neighborhoods and communities. These inequities are social, economic, and environmental. And so as we build our guidelines, and as we talk about our guidelines, we need to take into account the different level of resources required to care for these 2 different patients. NMA members care for many of these patients every day, but most of our members care for patients like patient number 2, who live in neighborhoods who have borne the burden of long-standing inequities that are social, economic, and environmental. And if we are really committed to assuring access or sustaining access to excellence in medicine, to make sure that every American gets the benefit of better health care at lower cost with better health outcomes, then we need to make sure that our efforts around reporting are not misleading and that really reflect the level of complexity and care that's required. So those are our two of our clear health policy priorities at NMA, that guidelines and reporting measures incorporate what is required to take care of patients with disproportionate burden of disease. I'm gonna leave one more with you. My patient who lives in Georgia would benefit if my state would just expand Medicaid. So together, we have to work to make sure that every state in this country expands Medicaid, because expanding Medicaid extends the benefit of health insurance to every American, to many Americans who work every day and don't have children, but don't make enough money to purchase insurance on the exchange. Now, I said I'd leave one thought that we can all do to move toward health equity. One of the best lessons I learned in medical school from a professor that I will always kind of have a special place for is not the medicine, but the best thing that we can all learn to do is learn to listen. To listen to our patients every day as health professionals. And what Dr. Brittingham would say is that you have a responsibility to learn to listen to your patient because they know more about the disease than you do. And if you listen long enough, you can learn to care for them as well as to care about them. And in that, you can learn what is necessary to address the needs of that patient. So by listening to patients, we can move toward better health care, one patient at a time. But I would challenge us not only to listen to our patients as individuals and deliver value to individuals and families at the patient level, but I would challenge us to listen to our patients at the aggregate level of neighborhoods. Because when we do that, we can find the ways to address those long-standing inequities of economic, environmental, and social problems that we refer to as the social determinants of health, which together with better health care, addressing social determinants, we can move toward health equity and sustain a journey to health equity that all Americans benefit from good health and take advantage of opportunities that are available to us. And so I want to thank you for the opportunity. As president of NMA, it was a privilege to have the opportunity to kind of set the stage here and share with you our priorities and hopefully challenge each of us to continue and work hard on this journey to health equity, because it is important to all of us as Americans. Thank you very much.
I'm now going to ask Dr. Tran, who is CEO of the National Council of Physicians and Pacific Islander Physicians.
I will follow the footsteps of Dr. Sanders and very much appreciate the opportunity. So greetings first, Congresswoman Kelly. I'm very honored to be here, and thanks for the invitation. Dr. Gary Puckrein, and good morning all my friends and distinguished guests, Dr. Donors. So I'm bringing to you greetings from the National Council of Asian Pacific Islander Physicians to the 12th Annual Leadership Summit on Health Disparities and Congressional Black Caucus Spring Health Braintrust, marching toward health equity. Dr. Gary Puckrein and the Congressional Black Caucus over the years, is for me the embodiment of equity. The reason being is that Dr. Puckrein has very much been sensitive and to bring me second to Dr. Sanders, because for us as the organization, we are the new kid on the block. So we have the oldest National Minority Physicians Organization, more than 100 years ago organized, and you have the youngest one. And Dr. Puckrein and the Congressional Black Caucus always make sure that our voice is being included, to be with you, to bring with you information from our community, and together to march forward to the health equity that we all talk about. So thank you very much about that. For us as an organization, like Dr. Sanders, I will follow your footsteps. Who are we? So we are organized as physicians, Asian physicians, Native Hawaiian and Pacific Islander physicians, that we advocate, that we come together. We advocate for optimal health for our population, for our patients, and our communities. So I do believe that we have the same kind of policy agenda, kind of policy statement that we put forward: access to care, universal access to care for all Americans, and that care should be quality, compassionate, that understands and that benefits the diverse population that we serve. I'm very much saying that understands and fits, because that's what Dr. Puckrein was talking about, the differences in the biogenetics of the disease, for example, the differences in accessing to care depending on different populations, depending on also on, sorry, I speak French sometimes, on the, like Dr. Sonner was talking about, the social determinants of health, that how can we access to care, even though that one I could be in the middle of a hospital or clinic, but if it is not the language there that my people can understand or be understood, there's no access at all. So that is what we stand for as an organization: optimal health, about access to care, about quality care, about how to understand it means that the research because as far as the nation population, Native American, Native Hawaiian, and Pacific Islanders, specifically Pacific Islanders as well, we are a very diverse group that comprises of more than 80 countries, distinct countries, and speaking different language, about 100 language together. So on behalf of our members, that we thank the Congressional Black Caucus, we thank Dr. Puckrein to include us in this march toward health equity. So you can say, you can count us in. Let me close with one story from Dr. Sanders, like the example from Dr. Sanders, one story that I came as a refugee from Vietnam. And that, with the work that I've been doing over the last 20 years, I have been crisscrossing the country from north, south, east, west, midwest, that I have witnessed discriminations, I have witnessed inequities, and at the same time I have witnessed disparities in the health status as well as in the health care delivered to our people. So that's how it is so important for us to be here today with you all to march toward that health equity so that everyone, regardless of who you are, what background you come from, that we have that much quality care that we all need to move forward in our daily life. Last but not least, that I came from, as I said, from Vietnam. English is my second language. Sometimes 20, 30, 35 years ago, I couldn't make myself understood, either depending on my accent or depending on my culture, that I was not enough, speaking out loud. So one day I went to Walgreens in Chicago. I live in Chicago, Osco, and I was asking the salesperson to help me find the magnificent glasses. After main explanation of what I want to, and finally he was saying, you want to buy the magnifying glasses. So I can tell you that from that day, that I see life and through my magnificent glasses. And I wish that all of us, we could march toward the health equity through these magnificent glasses. Thank you.
Thank you so much. I'm now going to ask Dr. Barbara Hutchinson, the incoming president of the Association of Black Cardiologists, to bring greetings.
Thank you. I say top of the morning to you, and as the president-elect of the Association of Black Cardiology, I bring you greetings today on behalf of our board of directors, our members, our staff. Today, our president, Dr. Isilma Fergus, is just returning from a medical mission, so she's unable to be here today. Thank you again for joining the National Minority Equality Forum and the Congressional Black Caucus Health Braintrust. This year's conference, which is the 12th year, this year we plan to take a solutions approach to achieving health equity and eliminating health disparities. Within the last 2 weeks, the Association of Black Cardiology, the International Society of Hypertension in Blacks, the clinical community, the research community, the academic communities, the African American community, the urban and underserved community, we lost two amazing warriors, Dr. Elijah Saunders and Dr. Levi Watkins. Their accomplishments and accolades are too numerous to count. But I would like to pause here, and I'd like you to join me in a moment of silence. Thank you. Although I represent the Association of Black Cardiologists, we are here with you over the next 2 days to explore solutions for eliminating health disparities and also solutions for assuring health equity. And we'll be looking at these through the lenses of cardiovascular care, cancer, infectious diseases, HIV, chronic pain, and depression. We all know that these conditions affect people of all ages, all ethnic groups, all sexes, all economic classes. However, despite advances, there are population groups that share a disproportionate burden of these diseases. As you know, our poor and poorly educated, those with language barriers, racial and ethnic minorities make up a large part of those that are impacted by this. And this is why we are all here today. So for this conference, the Forum and the Congressional Black Caucus have convened a number of experts, many of whom we know, and some of whom we'll be hearing from for the first time. But I hope that during these interactive sessions that are coming up, that you would ask pressing questions, and hopefully we'll be able to give you answers. So continuing from a perspective of collaboration and capacity building, we encourage you to work with the Association of Black Cardiologists, the National Minority Equality Forum, the Congressional Black Caucus, Health Braintrust, the American Medical Association, the National Medical Association, the International Association of Hypertension in Blacks, the National Hispanic Association, in an effort to help us all save lives. Despite our progress, we are all far from reaching our goals of optimal healthcare and outcomes for all people. So thank you. I hope you enjoy the conference, and let us all help to move the needle forward. Thank you.
Finally, I want to ask Dr. Julie Goonewardene to come up and bring greetings from the American Medical Association.
Good morning, everyone. My name is Julie Goonewardene. I'm a first-generation American with a Sri Lankan father and Australian mother, which is the source of my tongue-twisting last name. I also am humbled to tell you that I am not a physician. I am the public member. I am your patient. I am the public member of the Board of Trustees for the AMA. And I'm here to welcome you on behalf of the AMA, to express our delight in being here and our commitment to being your partner. The work that is going to be done here today is so very, very important. And we've talked about the rise in the changing demographics of this nation, and yet these terrible health disparities still exist. What I'd like to talk to you for a few minutes about is what I consider to be the new AMA, the ever-changing AMA, the inclusive, innovative, more nimble AMA. And in the spirit of getting onto the solution side of this equation, I'm going to talk to you about a couple of programs that we have going. We have a new strategic plan, and one of our focus areas is improving health outcomes. This is a sweeping initiative. We have put our money where our mouths are, and this is a multi-year, multi-million-dollar endeavor. And we know we are stronger with our partners, and we are seeking to create specific improvements in the number of adults who have blood pressure that is uncontrolled, unacceptable blood glucose levels, and don't have their lipids controlled to the level that they should be. We also believe that these factors target cardiovascular disease and type 2 diabetes, which we've also talked about this morning. And as we've heard, if we are successful in these endeavors, we can have a remarkable positive outcome for this country. At the AMA, we call these moonshot goals. The tragedy of our country is that these diseases disproportionately affect minority, soon to be majority populations. In our efforts, we are partnering with the U.S. Department of Health and Human Services Million Hearts Initiative, the Centers for Disease Control and Prevention, the National Diabetes Prevention Program. And we're also, as we also heard today, aggregating at the community level. We're partnering with the AMA and developing community-based programs. The YMCA in particular has implemented evidence-based diabetes prevention programs based on a model that has reduced the risk of developing type 2 diabetes by 58% in adults with prediabetes and as much as 71% by those over age 60. The YMCA program is part of the CDC's National Diabetes Prevention Program, and the Y is participating in a grant-funded program that allows Medicare-eligible adults in 17 communities to attend at no cost. And the AMA is also partnering with the Y to help get as many Medicare participants as possible into this program. In terms of hypertension control, the other plague that we've talked about today, we've developed something we call the MAP for the optimal hypertension control. MAP is an acronym for Measure Accurately, Act Rapidly, and Partner with Patients to Promote Self-Management. We have compiled a checklist for each element of the MAP. Our pilot clinical sites have helped develop and test these checklists and have helped us refine, easy for you to say, the MAP framework. We're already working with the Quality Innovative Network National Coordinating Center to spread our MAP partner framework. I'm humbled to be here with my colleagues, Dr. Sanders, the Honorable Robin Kelly, Dr. Tran, and Dr. Hutchinson. I hope that what you will take away from these comments is that the AMA views it as a privilege to be here, and we are committed to being your partner and your colleague. I am personally grateful to be here, and I hope to learn from all of you today. Thank you.
So not unusual, we're running a little behind, so I'm going to get us to our sessions immediately. Chris Irvin, are you here with us? The CME programs are going to be next door, so if you're going to join us for the CME, I ask you to wander that way. And our plenary session, if we can get the next speakers to come up. I want to thank everyone of the panel for their words. I think you heard some reoccurring themes for them about the growing diversity and the need to meet the challenge and what the various organizations are working through. So hopefully in the course of the day, we can follow through on those themes and come up with a plan. So let's get on to our next session. Thank you so much. Thank you so much. Great, great, good. Okay. Oh, we'll do a quick photo.